Life Unrehearsed on CJD 800, brought to you by alavida.ca. Celebrate a life well lived before or after death.
And good afternoon. Welcome to Life Unrehearsed, a show about the ins and outs of family life. So your life isn't going exactly as planned. Well, you're not alone, and we're here to help out. My name is Matt DelVecchio. I specialize in free retirement home search and senior transition support. Here with my co-host, Corrie Sirota, clinical social worker and psychotherapist specializing in grief and loss. Corrie, coming right up. You know, cancer can be devastating not only for the individuals affected by it, but can also take a toll on family and friends. But compassionate care and support does exist out there, and we're going to be talking more about this shortly. Corrie, you are talking about some type of yoga open house. What's that about?
Don't ask me. I'm going to apologize
in
advance for pronouncing it like this, but really very humbled that Moshka Yoga in the West Island is doing an open house on June 8th. The proceeds of which are going to Camp Erin, my very special near and dear program for bereaved children. It's a free camp for children who've experienced a death in their family. And so I am very humbled by Moshka Yoga in the West Island for doing such an event and recognizing the importance of that service.
Yeah, amazing. And all proceeds do go to your incredible Camp Erin. So shout out to them as well. Talk about shout outs. This evening, in fact, the Israel Cancer Research Fund is having their 41st annual gala. It's going to be at Place des Arts, Théâtre Maisonneuve, and believe it or not, they have Don Felder. You know who Don Felder is? He's the ex-guitarist, former legendary guitarist from the Eagles. He'll be playing all the Eagles songs live, all their big hits. There are still tickets available, by the way, Corrie, and that show starts at 8 o'clock, and Corrie and I will be heading down to that event. We're very fortunate to participate and looking forward to that as well.
Without a doubt. It's because I'm old enough to remember who he is, right?
And not only that, they are specializing, they're going to be supporting some urologists in this as well, and it's for a very, very good cause.
Well, great segue. Speaking of urologists, in the second half of the show, we're going to be talking with a prominent urologist, Dr. Liberman. He's works out of Chum and a private clinic as well. What do you need to know about bladder and kidney problems? How serious are they? Stay tuned for that.
It's going to be very interesting. And Corrie, that's near and dear to your heart. You don't want to miss that second half as well. All right, let's get right started. And Corrie, as you know, no matter who you talk to in life, someone has been affected by cancer in one way or another. It might be either directly or through a family member or a friend. As you know, Corrie, we've talked about my mom, who is a cancer survivor, and she's in full remission, rock star, my hero, going to the gym every day and doing fine, loving life. However, I do know when she was going through it a few years ago, she could have benefited from more support. At times, she's saying she was on an island. And, well, you know, there's hope. And that's why we have our two amazing guests. And I first have to preface this, Corrie. We do a live show, and we're at 1717 Boulevard René Lévesque East. And as you know, it's Tour de Lille. Throw that in with the regular weekend construction, and it's traffic Armageddon out there. So we do have regular traffic reports here on CJD. So I first want to thank our guests for even making it into the studio. Dr. Liberman is also in studio on the second half. They made it. Corrie, you and I made it.
That's right.
Barely. Barely is right. But I do want to welcome Debbie Magwood, founder and executive director of the West Island Wellness Cancer Center, and Maggie Costa, their director of development, in studio with us. Welcome to Life Unrehearsed.
Thank you for having us.
Thank you very much.
You know, it's wonderful that you're here. It's an incredible center. Debbie, we're going to start off with you. Talk about a Life Unrehearsed. You are a poster child for Life Unrehearsed, I think. Please tell us your story and how the West Island Cancer Wellness Center was founded.
Well, first of all, thank you both for having us here today. It's a long story, then I'll give you a very abridged version. I was diagnosed for the first time with cancer in my early 20s, newly married, in the job of my lifetime. And really the only thing I knew about cancer at the time is it kills. So I was shocked by being so young and being diagnosed, and tried to look for help around the community and really found nothing. Fast forward a couple of years later, or even 10 years later, and I had another diagnosis. And at that point, I was just frustrated that as a young woman, I didn't know where to go or where to reach out for help. So that kind of just started me on this adventure to try to find out how can one live well when being diagnosed with cancer. And, a few years later, I met some really amazing people, and we decided that we were going to open up the West Island Cancer Wellness Center, and we're hitting our 10th birthday this year.
Wow, thank goodness for trailblazers like yourself, because I know that the service, working in the field of grief, I know that the service is so well used and so important. Talk about compassionate care. I understand that you have a very unique approach to the way in which you service and help families, and that includes mind, body, spirit work. So can you speak to us a little bit about how that works?
Absolutely. The medical system does an outstanding job at taking care of the disease. And, we're proud to say we take care of the rest, the whole person. When cancer hits, it hits a family. It hits you spiritually, along with physically and emotionally. So we offer the services that the medical system just doesn't necessarily have time to do. And they're divided into those 3 areas of care: mind, body, and spirit. And there's things, like yoga, meditation, massage, counseling, nutrition, exercise programs. And all of these programs are empirically based and are proven to either help through the surgeries or the therapies, or to help the body and mind and spirit heal afterwards.
I just love that approach. That's Debbie Magwood, founder and executive director of the West Island Cancer Wellness Center, in studio with Maggie Costa, their director of development, talking about cancer support. And just to expand a little bit on the mind, body, and spirit, and Debbie and Maggie, I was fortunate to get a tour, my second tour, but it was nice to get a personalized tour just a couple of weeks ago. And I was amazed at just some of the things that go on to reflect that mind, body, and spirit, because it's not just about the actual, perhaps the individual going through treatments, but it's very much supportive of other family members as well. Can you give examples of, I guess let's start with the mind, because I believe that's so much part of it, the whole psychological effects of it. Give some examples of what you would do to assist with the mind aspect.
Well, the mind would vary from anything from pure educational sessions. So we might have guest speakers coming in to talk about, skin cancer, or we might have somebody in to talk about genetics and the importance of genetics in cancer. So there's an educational component, but then there's the psychological component as well. So we're associated with many universities across Canada. If they have interns that want to come to us and do an internship site, they do our counseling. So we have counseling, we have support groups. We have the gamut. We offer about 1,600 hours of individual programming every single month. So it's quite a bit.
Every month. Wow.
Well, so that's one of the many aspects. And I know I'm fortunate that I teach at McGill, and I know the students that go. And they always speak so highly of the program and the learning. We are about to go out to traffic, but I wanted to pose a question that we'll hear when we come back, and around what can you tell someone who's been diagnosed with cancer? What do they need to know, and where do they even start? So we're going to
Corrie,
hear about that.
I think it goes through a lot of people's minds, oh my goodness, because it comes like a shock.
Yeah.
And there's immediate panic, I suppose. You must see that. I see both of you smiling. Yeah. You must see that in your world. So that's going to be a very interesting topic.
So we want to hear some of your explanation of that, but as soon as we come back from traffic with Lauren Glazer.
Life Unrehearsed on CJD 800, brought to you by alavida.ca. Celebrate a life well lived before or after death.
Hold on and be strong. I can feel it getting better.
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Sirota with my co-host Matt DelVecchio, and we're talking about cancer support with Debbie Magwood. She's the founder and executive director of the West Island Cancer Wellness Center, and Maggie Costa, their director of development. Right before traffic, I asked the question, and it's a loaded one, I know. I understand that. But somebody's diagnosed with cancer. What kind of advice? What do they do? Where do they go? Go.
In 10 seconds or less. I think, when people get diagnosed with cancer, it's like a tsunami. You have these incredible emotions that range from denial to fear to, hope. And what we hope is that at that point, people are given our number, and that they can call up to the West Island Cancer Wellness Center, and we will be with them wherever they are. So if somebody comes in, like I always vividly see in my mind's eye this woman who was 65 years old. She was literally just diagnosed, and the doctor handed her the paper, and she walked through our front door about half an hour later. And as she walked through the front door, her knees buckled, and we just went over and grabbed her. And we brought her over to the couch, and we sat her down, and she cried, probably nonstop for about half an hour. And we just said, okay, we're here for you. What do you need? And in essence, that's what the Cancer Wellness Center is. We are, all our programs they're not designed as though you do X, Y, and Z. You create your own wellness recipe, based on what you're experiencing at the time. So if you're experiencing a lot of anxiety, for example, then we have a whole list of things that can help people with anxiety.
Just listening to that, Corrie, it's heart-wrenching, but also at the same time, it's reassuring. I could just picture that. There you are, you're literally holding this person up, and, good for you. That's Debbie Magwood, the founder and executive director of West Island Wellness Cancer Center, with her right-hand person, Maggie Costa, their director of development, in studio with us on Life Unrehearsed. If those of you who are listening to us on Life Unrehearsed Facebook page, you would have heard off air that Debbie mentioned to us, which we were not aware of. Today is International Cancer Survivorship Day. Did I get that right?
Yep,
yeah,
that's right.
Wonderful. And we talk about cancer, and there's a stigma about cancer being a terminal illness. And Debbie, you've mentioned also in the past that through medical advancements and support, many forms of cancer are actually moving from terminal illness to chronic illness. So tell us more about that.
Absolutely. About 75% of people who are diagnosed with cancer don't die. We put a lot of focus on palliation and dying, but the mass majority don't. And, those are our survivors. Those are the people who are, figuring out ways to live well after having had that kind of diagnosis. And it's really important to do that and to let people know that there are organizations such as ourselves that do empower people and give them the resources that they need to live well and to be part of that, hopefully part of that 75%.
Certainly very encouraging to hear about the services and the mandate, basically your mission of what you're doing. But also heart-wrenching in that I'm wondering, you have to be a very special kind of person, I think, to do this kind of work. How is the center staffed? Is it all paid employees? Is it volunteers?
There are 8 paid employees. And nobody works full time, so it ranges from 2 days to 4 days a week. I have to say they are angels on earth, low pay, big hearts. And then all the services that we offer, those 16 hours of individual programming services I spoke about earlier, those are all given by experts in their field. So they are experts, kinesiologists, exercise trainers, nutritionists, dietitians, yoga masters, Tai Chi. Every one of them work in their field, have been working in their fields for years, and just donate their time to us at the center. And they too are wonderful human beings.
It really is incredible. I mean, so we're talking how many volunteers? A dozen? Much more?
We're looking at over 60 regular volunteers right now in the programming department. There's another 150 who help behind the scenes to make the charity survive.
That's an important point. 150 behind the scenes, but these 60 are actually true professionals. This is what they do, offering their time and services for free. And let's focus on that word free. All the support you're giving, if we understand, you don't charge your clients. And I don't even know if clients is the right word that you would use in your world, but it's all free of charge. Is that correct?
It's all free of charge. And we call them participants because we're there for the person who has the cancer themselves, but also for their loved ones. Right. But I'll tag over that free of charge thing over there to Maggie on.
Well, let's jump on that because obviously you need funding. Volunteers can take you so much, Maggie, right? So explain how are you funded, and if there's anything we could do at our end to get the word out so you get a few more funds.
Well, we are funded. We are a charity, of course, a nonprofit organization, and we are funded by individual donations, corporate foundations. We do not get any government funding or from Centraide or those big organizations. So we do rely on the community. We do rely on individuals to help us keep the center open, to keep our participants, for these services, to keep them free of charge. So definitely our donors, everybody who's been a huge support since the beginning, have been with us since the beginning, are fantastic. So definitely it's all by donation.
That's incredible. And that is Maggie Costa. She's the Director of Development at the West Island Wellness Center. And she's here with Debbie Magwood, the founder and the Executive Director of the West Island Wellness Cancer Center. And we're talking about helping families when there's been a cancer diagnosis. Who do you go to and what do you do? Let me ask you, is the center specific age, demographic? Who can come?
Anybody can come. Anybody, all ages, male, female, and any types of cancer as well.
And when we just expanding on that, because you had mentioned also it's not just for those that are experiencing cancer. I would imagine you had a whole the support network, families and friends. They're more than welcome to show up as well.
With the caregiver, absolutely. We support the family as well, for sure, 100%.
So anyone qualifies?
Well, there's a little bit of a disqualification factor. So if you have been diagnosed and it's all the way up to 1 year post-treatment. So after 1 year post-treatment, we are not the organization that you would be able to reach out to. But from diagnosis to that 1 year post-treatment, we're them.
Fair enough. I mean, at some point you have to, I guess, put some boundaries on because you want to make room for the newly diagnosed.
100%. Absolutely. And we also believe that, we need to move on. And we're hoping that within that year that they've been with us, or year plus that they've been with us, we will have taught and empowered enough so that people can sort of take a step away from being a cancer patient and just live what they've learned.
It's very inspiring. We're running out of time, but just really quickly, you talked about all the activities and support groups that you do. If you were to pick one or the two more popular ones, what do you think the benefactors of your participants would be? Which are the more popular ones?
I couldn't. I couldn't.
Okay.
There's too many.
There's too many. They, as I said before, you go to what attracts you or what you need at the time. So if I'm in chemo and I'm having trouble eating, I might be attracted to the nutritional program. Or if I'm stressed, to more of the spiritual or relaxation part. Or if I'm post-treatment, I might want to do more exercise because now I can.
Incredible. Now, yeah. Debbie Magwood, Maggie Costa from the West Island Wellness Cancer Center, thanks so much for being on Life Unrehearsed. How can people get a hold of you?
Well, you can definitely visit our website, which is wicwc.org, and our phone number, 514-695-9355.
Give that number one more time.
514-695-9355.
Great. Thank you very much for being with us.
Thank you for helping so many. Coming up after the news, I had a very recent health scare, and I was able to navigate through it thanks to my new best friend, my urologist, Dr. Liberman. And so we're going to talk after the news. We're going to talk about what you need to know about bladder and kidney problems. How serious are they?
Life Unrehearsed on CJD 800, brought to you by alavida.ca. Celebrate a life well lived before or after death.
How am I gonna be an optimist about this? How am I gonna be an optimist about this?
Welcome back to Life Unrehearsed. I'm Matt DelVecchio, specializing in free retirement, home search, and senior transition support here with Corrie Sirota, clinical social worker and psychotherapist specializing in grief and loss. Hope everyone out there is managing through a traffic Armageddon. But both our guests made it in studio. Corrie, we're very happy, and we're going to be soon talking to Dr. Liberman, leading urologist. And I guess, Corrie, I'd like to throw it over to you because you had a medical scare that I can't imagine what you were going through in those few weeks.
This is what raised my awareness about the whole concept. I didn't know about what urology was really before a few months ago. And then I went for a random test, and all of a sudden I was told I had abnormal cells, and my world went into a tailspin. And I was like, what? But very, very thankfully and gratefully, I was able, there was nothing serious in the end, although during the process I was terrified. And be honest, I still need to be watched, but really everything, thank God, has become clear. However, during this process, I was able to meet a very special person, Dr. Daniel Liberman. He's not only a urologist, in my opinion, extraordinaire, but he's kind, he's compassionate, and he really helped me navigate the entire experience and continues to do so. So all to say, it certainly helped me realize that bladder and kidney issues are something that we probably don't know enough about, and they can be very serious. And that's why we have Dr. Liberman on the show today. Welcome to the show, Dr. Liberman.
Thank you so much for having me. And you were a very, very strong patient. I'll just tell you that.
Thank you. I think, like me, I'm going to ask the question because I didn't know it. Can you define what a urologist does?
Well, first of all, we're surgeons. We deal with the whole urinary system, kidney, bladder, the prostate. We deal with all the below-the-belt issues for the man. People think that urologists only treat men, but we actually treat women who have bladder, pelvic problems, and kidney stones.
Dr. Liberman, I guess listening to you cover a broad range of serious issues. And one of the questions that I always think of is, should I be looking out? What are some of the signs and symptoms of, perhaps let's start with bladder. What do I need to be looking out for in case there are some red flags?
Well, first of all, it's good that you mention it because a lot of people sometimes underreport their bladder issues and urine problems, erectile problems, because they feel embarrassed. So it's important that people understand that this can affect their quality of life significantly. Urinary urgency, frequency, trouble emptying their bladder, getting up at night 3, 4, 5 times, erectile dysfunction, urinary leakage, recurrent bladder infections. These are all the signs and symptoms of bladder, prostate, and also everything related to urology in terms of the lower genital tract.
Okay, I'm going to stop you right there. So my 2:30 in the morning, got to get out, just can't hold it in. Should I be concerned? It's only once a night, or am I okay?
Well, you know what I always talk to patients about? This is a quality of life issue. If your quality of life is affected by it, I want to know about it, and I want to help you treat that problem. If you're not necessarily so bothered by it, you get up once a night, you fall right back asleep, and there's no problem, then, that's okay. So it really depends on the patient, and that's what's important in being a physician, a urologist. It's really patient-centered, and if it's a quality of life issue, if it affects you, then we go ahead and talk about how we can help you.
That's Dr. Daniel Liberman. He is a urologist, and he is helping us understand bladder and kidney issues. So let's move a little bit to some of the kidney issues and what it is that we need to... How would we even know something was going wrong?
Well, it's a good question. I mean, people, if having, let's say, kidney stones, would have possibly kidney pain or renal colic, we call it, bladder problems, an overactive bladder, meaning urinary frequency, urgency, urinary incontinence, bladder pain. And of course, sometimes people do come to a urologist because they start seeing blood in their urine. Mm-hmm. Sometimes people are referred by their family doctor for microscopic blood, meaning blood that they don't see but seen on a urine urine analysis, but sometimes people also can see blood in their urine that they, and that can sometimes point to more serious things like bladder cancer. And when I mean serious, I mean more of the cancer, although the benign bladder problems can also be very, very serious, and it can affect people's quality of life significantly.
Dr. Liberman, we're going to switch gears a little bit also. We had Debbie Magwood from the West Island Cancer Wellness Center beforehand saying that 75% now of cancer victims are survivors, and that's increasing all the time. I know from a male perspective, prostate cancer has been drastically reduced, yet still a major concern, particularly for males. Can you comment on that, and should everyone be getting a PSA test?
Well, it's a very important question, and I'm sensitized to that because one of my areas of focus is what we call prostate cancer survivorship. What does that mean? That means a person's been diagnosed and treated of prostate cancer. Sometimes people have been cured of their prostate cancer, but what are they left with? Sometimes the complications related to their prostate cancer treatment: urinary incontinence, erectile dysfunction, trouble emptying their bladder, urethral stricture disease. So it's important that when we embark on PSA screening, we understand that this is a process, the first part of the diagnosis, if it's a biopsy, and then if it's treatment of prostate cancer. So it's important that people are aware of what prostate cancer screening is, how it helps, but also what it would lead to.
Isn't he great? I told you he was so great. Like, I just love listening to him. And he's talking about urine, and he's talking about like bladders and all that kind of stuff. But it's amazing. What age should someone start to, whether it's the PSAs or any kind of look out for something? Is there an age?
It's a good question. So if you're talking about prostate cancer screening, we normally, according to recommendations, it all depends on if somebody's had a family history. So if somebody's been diagnosed of family member's been diagnosed of prostate cancer at an early age, well, we would probably start prostate cancer screening earlier. We would say about 45 to 55 years old, people should be starting to have, if they again decide to have prostate cancer screening, what that means is they have a annual blood test as well as a rectal exam by their family doctor, and if there's any warning signs, a urologist is then consulted.
Interesting. That's Dr. Daniel Liberman, a leading urologist here in Montreal, who's in studio with us, and we're talking urology in general, bladder, kidney, prostate. You mentioned PSA, I guess, would be one of the younger ones. But what would be the average age? And I'm just talking because in your world, you're seeing for bladder, for kidney, for PSA. When should we be asking our family doctor, maybe it's time to see a urologist? Is there an average typical age that you would be seeing patients?
Well, it's all, for the most part, if you're not talking about screening, you're talking about symptom-based, right? So if somebody's a young woman who's 20, 30 years old who's having recurrent urinary tract infections, that's something that would elicit a consultation. If somebody's an older gentleman who's having frequency peeing at night, then they would also see a urologist. So it's really all spectrums of age that we would see. There's even young pediatric urologists who take care of babies and teenagers with urinary problems. So it's really all the whole spectrum.
So it crosses the gamut. Here's a question for you, and we do have to go out to traffic. So when we come back from traffic, Dr. Liberman is going to answer this question. Are there ways to prevent bladder problems or any kind of kidney illness? First, we're going to go out and hear Lauren Glazer at the CJA Traffic Center.
Life Unrehearsed on CJD 800, brought to you by alavida.ca. Celebrate a life well lived before or after death.
And welcome back to Life Unrehearsed. We have in studio Dr. Daniel Liberman, leading urologist here in Montreal. And Dr. Liberman, I first have to start, Corrie, when you were going through this medical scare, I was amazed at the comments you were making about Dr. Liberman, because let's face it, sometimes in the medical field, there's a bad rap for doctors. They don't have time for patients. They got so much on the go. And you were saying things that I couldn't believe Dr. Liberman was doing. Compassionate.
But now you can.
A gentleman and human, and I'm seeing this firsthand as well. So, Dr. Liberman, hats off to you from one patient right across from me, just glowing reviews, and I could see that this is who you are. And God bless, and we know it's not easy because this is just one patient of hundreds, if not thousands, that you've seen. When we went out to traffic, we wanted to find out about ways that we could prevent bladder problems. So what would you suggest we could do to prevent these things?
Well, I think it all depends on kind of what type of bladder problems we're dealing with. But in general, we're talking about living a healthy lifestyle. We were talking about body, mind, spirit, body, mind, soul. That's really important. Staying fit and healthy, decreasing the amount of caffeine, because caffeine is sometimes an irritant for the bladder, drinking enough water, stopping to smoke. So all of those things, general counseling that we do is important for people with bladder symptoms.
So knowing that, we know that reality happens. People get things like you mentioned earlier, kidney stones. I don't really understand kidney stones. So can you explain that?
Well, kidney stones is, it would be interesting if Dr. Schwartz was here, because he'd be able to explain that it's all about chemistry, and it's all about certain factors that cause the kidney stones to be formed and kidney stones to be absorbed. And all in all, people can have really, really horrible pain, 10 on 10, 15 on 10. Women have come up to me and said, I've had a vaginal delivery without any anesthesia, and then I had kidney stones, and kidney stones were 10 times worse. So it could be very, very severe. And if people have had kidney stones, we can analyze the kidney stones. We can do blood test, urine test to be able to find out why they're more likely to have kidney stones. But again, general counseling for kidney stones, it's you got to drink at least 1 to 2 glasses every about 1 to 2 hours. So a glass every hour.
Oh, okay.
That means you got to hydrate, try to dilute those stones. Other than that, it's also understanding what we can prevent if we're having calcium stones versus uric acid stones, reducing the amount of sometimes fried foods, which has a high salt intake, avoiding putting the salt shaker on the table, remove the salt shaker from the table. And there's other ways that we can do it, but it's very patient-centered when we see somebody, because there's a plethora of variables that can affect why people have kidney stones.
That's Dr. Liberman here on Life Unrehearsed, a leading urologist talking all types of issues related to urology. So, Corrie, I just heard no more French fries, no more salt on the table. We're going downhill here. I don't know what's going on. However, you offer great advice. Rapid fire questions. 2 most popular questions, one for men, one for women. In terms of treatments, you had mentioned for men, it's mostly prostate related. What type of treatments can you recommend?
Again, there's general counseling. If somebody has prostate-related issues, it's, again, we're following the Canadian recommendations for healthy living, eating. There's medications. There is physical therapy that we can sometimes offer. And if medications, physical therapy then fail, then sometimes there's the surgical option for men with prostate-related issues.
And for female, urinary incontinence.
Urinary incontinence is a big topic, and there's a lot of patients that I see a frequent consultation is urinary incontinence. Well, how do you treat urinary incontinence? You start with, again, the baselines, try to lose weight, stop smoking, physical therapy. There's many different aspects of physical therapy that help with incontinence. And if that doesn't help, well, sometimes for stress urinary incontinence, there's also a surgical option.
We thank you for that very detailed response. We got a text, and I can't believe I'm going to read this. When I have a full erection, at some point I feel half numb. Is it normal? Start to happen recently.
That's a very, very common consultation, erectile problems, problems with ejaculation. And you know what? What we do is erections are a multifactorial thing related to the psyche, the psychological component, the organic component. So when we want to treat somebody with that, we would maybe refer to a sex therapist. We would maybe try medications. We would maybe try some other types of imaging to be able to find out why this person has numbness. So there's a lot of things that we can offer these people.
Thank you.
And
so
that's
much.
what's important is everybody has to understand that we have tremendous amount of options available. And it's not just, well, you're stuck with that and live with that for the rest of your life. And that's what people have to know.
Thank you so much, Dr. Liberman. You've been a wealth of knowledge in such a short period of time. And for this caller and or anyone else, how do people get a hold of you? I know you're part of a clinic called ELNA. How do people get a hold of ELNA?
So I'm affiliated with the University of Montreal Health Centre, the CHUM. I see a lot of patients at ELNA Urology. Shirley, who's the fantastic clinic manager, the number at ELNA Urology is 514-370-8884.
It's wonderful. Dr. Lieberman, thank you so much for being with us on Life Unrehearsed. Now, Corrie, next week, I am off. You are going solo. So what do you have going on next week?
Next week, we're going to be talking with Mitch Lerner from West Coast Connection about travel tips for both individuals and families. And for all you theater fans out there, we're going to be meeting with some of the actors from West Island Theater Association. Theater's not just a hobby. And you're also going to get a sample of their upcoming production of The Addams Family. So tune in for that.
And you can catch us every Sunday at Life Unrehearsed at 4 o'clock.